And just a reminder that after this week, next week we're starting on the pelvic girdle, and so after this week you should have all of the arms done, all the way down to the antebrachium. And to do that, I want you to cut through the mittens down past the wrist, about halfway down the metacarpals, so that you can peel the hide all the way past the wrist, because you're going to need to follow the tendons from the forearm muscles, the extensors and the flexors, across the wrist to be able to identify some of the muscles. So I'll tell you this over and over and over again as you're dissecting those. We want to read where those muscles insert, where they originate on the forearm and where they insert out onto the hand or wrist, because that'll tell you a lot about that particular muscle. Okay, so now, you know, most of you've got some kind of clearance around the scapula, and you know, once you get the trapezius muscles, thoracic and cervical, bisected, and can get up underneath the clitocervicalis, you can see the omotransversarius and the clitomastoid. This one's kind of mashed up, I guess, and sternomastoid, so I won't go through those right now on this animal. But you can then see the attachments of the scapula to the axis. And so we have a large complex, the rhomboids or rhomboideus complex, that originates on the thoracic and cervical vertebrae and inserts onto the dorsal border of the scapula. And there is an additional slip of the rhomboid complex that comes from the nuchal crest at the base of the skull. And so the main portion of the rhomboid is rhomboideus cervicis et thoracis, because it goes to the neck and the thorax. And this slip is rhomboideus capitis, because it goes to the head. And also, inserting onto that dorsal border is another muscle that comes up from the ribs. And so if you look medial to the scapula, you can see that sheet of muscle that forms a fan-shaped structure going down to the ribs. And to see that, actually, one other thing I want you guys to do with your animals is cut up through the pectoral complex. And when you're doing that, either ask me to do it for you or be really careful as you get up to near the articulation. There is a plexus, the brachial plexus, that has a number of nerves and blood vessels, and so usually I'll cut up a little superficial and then kind of clean up the cut and go down a little further. But try really hard not to cut through that plexus as we clean this out. You can see all the nerves and blood vessels that we're going to identify in the second half of class that come out of there. But that gives us some more mobility to see. In this case, as I was talking about the Serratus Ventralis, that muscle originates from each of the ribs through here, and if you clear this away carefully a little bit, you can see those slips that are coming from each rib, and that's where it gets its name. First of all, it's ventral. In us, it's serratus anterior because it goes out onto the ribs forward. But also, it's sawtooth shaped or serrated. So Serratus Ventralis refers to the shape of those attachments. And then they all collect in a fan, as I mentioned, up at the dorsal border. And so you can see that through here as well, the cranial portion of that right here. Also, you can see the intrinsic muscles of the scapula, so the muscles that come off each of the fossae of the scapula. And if you remember your skeletal anatomy, we have the scapular spine laterally, and then above that is the supraspinous fossa, and the muscle there is supraspinatus. And beneath that is the infraspinous fossa, and most of the muscle in there is infraspinatus. And on the medial surface is the large subscapular fossa, and that muscle is subscapularis. And all of those go forward to the articulation, the shoulder joint. Now, on the lateral surface or side, down by the infraspinatus, we have a couple of other muscles that you're asked to identify. One runs right along the caudal border of the scapula and goes through the axillary region and inserts onto the humerus medially. And that's this large Teres Major. So this is Teres Major right here. And it is not on the scapula, just above it is the infraspinatus, and it runs right along the surface of the scapula. Teres Major comes off this sharp caudal border that we saw in the skeleton and goes to the medial side of the humerus. And also, while we're here, remember the deltoids coming from the acromion and going down the arm to insert onto the humerus is the Acromiodelt, and coming more caudally, it's not really cleared away here, but from the caudal portion of the scapula spine and coming out at an angle to the humerus is the Scapulo Deltoid. And I want you to clear away the lateral border of the scapulodeltoid. It's hard to clear away the medial border because it's really tight in connective tissue, but this will allow us to see some of the brachial muscles as we get down to them, but also here's the scapulodeltoid here. Its origin on the scapular spine, its insertion out onto the humerus. And if we reflect it, bisect it about in the middle from that lateral border I just cleared away, and then you can't really separate it entirely from the infraspinatus, but we can pull it up a little bit. And similarly on the distal end, out by its insertion on the humerus, kind of pull it up. Then we can see the infraspinatus even better. So you can see the infraspinatus coming out here lateral to the humerus, and the Teres Major going deep and going medial to the medial side of the humerus. And in the infraspinatus, and I think they mention in the book about, look at about the base of the long head of the triceps, which, spoiler alert, that's this. But there is, and sometimes it's really tough to separate, there is a little muscle that's usually looks like it's embedded in the infraspinatus, and that's Teres Minor. And once you get it to separate, then you can see this nice little, cute little bulbous muscle that is kind of swollen, enlarged near its attachment to the humerus, and then gets narrower and narrower back near its origin, and is continuous as a really thin tendon that comes off the caudal border of the scapula. So this is Teres Minor right here. And Teres Minor acts with the infraspinatus generally as lateral rotators, and they're part of the rotator cuff. The supraspinatus in, I don't know about cats, but in us, that goes up and over the articulation and acts as an abductor. And then the subscapularis will run across the medial side as a medial rotator for the rotator cuff. And we'll talk more about that in lecture. Let's see, what else do we need to see? One other muscle, and probably wait until you get to the brachial muscles to see this, because you got to do a little digging to find it. But the Coracobrachialis, which is up in the shoulder and is an adductor of the shoulder, but again we'll cover after we see, cut through some of the brachial muscles to expose the shoulder. As you might guess from the name, Coracobrachialis originates from the coracoid process on the scapula and runs to the proximal humerus, the brachium. And so it's a small little muscle that just runs right across the medial wall of the joint. Now what I've just done here, kind of carefully, is cut through and separate the pectoral fibers that I had bisected before, and that'll allow me to expose the muscles of the brachium, start working my way down the arm. And also it kind of gives you an appreciation for the orientation of the pectoral insertions in the cat. These are all muscle fibers of the pectoral group that we identified this past week, and they run cranially and laterally to insert on the humerus. And one thing that's kind of interesting, kind of cool about, they'll insert most of the length of the humerus. And in doing so, they run over one of the flexors of the elbow, the biceps. So this is the Biceps Brachii. And they separate it from another flexor of the elbow that isn't cleared away here yet, but is on the lateral surface of the humerus, and that's the brachialis. And so as you start to clear this away, you'll see where the pectoral fibers come in and insert along the humerus and separate the flexors into Biceps Brachii and Brachialis. Now, as I did this, I kind of cut right along the edge of a thin muscle that cats have on the medial surface of the brachium that you guys will need to identify before you whack up the connective tissue around the arm. This muscle is the most medial, covers the medial wall of the brachium, and it inserts out into this fascial sheath around the forearm. So this is the antebrachial fascia, this sheath. And this muscle pulls on that antebrachial fascia, and so it's a tensor fascia antebrachiae. And that's this thin muscle here that you'll probably end up having to bisect or remove anyway to see the deeper brachial muscles. Okay, so go find that stuff. Remember, you're gonna need to identify all the way out